Well, I think one of the most important things we discussed today is that issues in healthcare and issues in people's lives are profoundly linked with other conditions in their lives. If you don't have quality housing, if you don't have access to good food, if you don't have the resources you need, then there are great inequalities in our healthcare system. So what people said today was they wanted to clearly make the connection between what is an increasing inequality in our society and threats to the health of communities as a whole. I'll give you just an example. We talked about it a little while ago. For me, as a personal example, I have insulin-dependent diabetes. And if you're in my position and you have a job as I do, which is a good job and paying well, you can do very well in managing your own health care. But if you don't have those resources, if you are on income assistance or if you're on a minimum wage job, your ability to get the food you need to balance your insulin is very difficult. So we made some of those links between what we call the social determinants of health, things such as housing and income and community involvement, the links between those and the need to improve public health in BC.
So what is something specific that you as an MLA can do about it?
Well, one of the first things we're doing is the first things we're doing right now, because I'm an opposition MLA, is fighting the government's efforts to privatize healthcare in BC. So we've been raising those issues, we've been shining a light, because what the government has tried to do, what the Premier's tried to do, is make many of these changes in secret. Secret deals, we saw it at St. Paul's Hospital where they used the publicly paid for MRI. They handed it over for private use and allowed people to jump the queue and to get preferential treatment for money. We exposed that, and that practice has stopped. The case of the Falls Creek Surgical Center, which appears to be opening a private emergency room, we have been taking that issue on, and we are fighting those efforts as an opposition to ensure that the government is held accountable, first of all, but their hidden agenda, I think, to weaken public health care is exposed.
One of the questions in our calendar, VCTA 2007, as a matter of fact, the first question and the first page, if you open, is about public health care.
Yes.
And we have been asking people about it, and they say that health care should be paid 100% by federal and provincial taxes. Do you think that's a possibility, or is it just a dream?
Well, I don't know if it's a dream, but I think it's not. I think it depends, and one of the things we discussed today is what we mean by health care. I think one of the important questions about health and people's health and the social determinants of health is that how your health outcomes end up in life, how you do in life, depends on a whole bunch of things. So it's not just health care money. It's money for education. It's money for income assistance. It's other issues that are important. We in Canada have what we call a universal single-payer program for what's defined as medically necessary health care. And I think most people believe that should be public and supported by tax dollars.
100% paid by tax dollars?
Well, for what we call insured services, that's our single-payer system in Canada, which says that for services that are defined in the Canada Health Act as medically necessary, then those services are covered by, in British Columbia, by the Medical Services Plan. Now, not everything we spend on health should be covered by government. For example, some people want to do things that are beyond what would be defined as medically necessary. Some people want to have plastic surgery for appearance sake, which is not medically driven. Clearly, government isn't going to pay for that. But for medically necessary care, we think that a public insurance scheme should cover those things, and that system works very well, and it's also the most efficient system. If you have a whole bunch of parallel private insurance schemes or parallel private payments, you're going to spend a lot more money on administrators and accountants and the administration of healthcare. In the United States, 14 cents out of every healthcare dollar, 14 cents out of every dollar they spend on healthcare in the United States is for administration. In Canada, in our public plans, only 2 cents is paid on administration. So it's not just a social justice question. What single payer, what universal healthcare in Canada offers is a combination of administrative efficiency and social justice, and that makes it just an outstanding, I think, public service and public program.
Okay, so regardless of, depending on the definition of what healthcare includes, what you're saying is that it should be paid by 100% by.
That's right.
And the simple question
what
here.
What you have is a public health care system in Canada and what we define as medically necessary in Canada is covered and should be covered by our public health care system, and that's what we're saying.
So you would vote here in this poll as 73% of the people have voted that it should be paid 100% by provincial and...
I think a majority of people believe in Canada, a majority of people believe in our public health care system, that when you go to have something that's medically necessary, and we're not talking about some issues which are health choices, we're talking about medically necessary services. If you break your leg and need that leg to be treated, that it should be done in the public health care system, and it should be paid for 100% by public resources.
Mm-hmm. The fact that we could or could not afford, depending on the budget, is not a factor to you?
But I think every jurisdiction in the world has to deal with affordability. It's always been the case in Canada. It was the case.
Can we afford to have 100% paid health care by the government?
Well, the question is, because people make that ask that question, and they pretend there isn't cost to not having health protection, right? And I think there are profound costs when we shift costs from taxpayers to the sick, because remember, this is healthcare. This is essential to our lives. So somebody's going to pay. And either those things are covered by a public system that's efficient and dynamic and works, or alternatively, we're going to have to pick up the tab ourselves. And that means there's going to be two-tier health care. So when people ask, can we afford it? Of course we can afford it. Most countries, most Western democracies and some other countries in the world offer universal public health care programs. Most of them differ in some ways, in some small ways, but they succeed in delivering public health care. And we have in Canada for a long time. And yes, there are costs and increasing costs today. People talk about technology and everything else. But you think of the last 30 years and the changes in healthcare. There have always been challenges for our healthcare system. This is nothing new. But what's changed is we have governments who do not believe in public health care, such as the Campbell government. And that's what's changed. And people, and I think it's the majority of people who believe in public health care in BC, need to speak out against what the Premier's planning, which are cuts and privatization.
All right, next question.
Yes.
It's about democracy. And we've talked about it before.
Yes.
And I was proposing that we have a perpetual type of electoral system.
Yeah.
With computers and the technology that we have nowadays, it is possible to have a perpetual type of electoral system. Whereas you don't have to wait for the government to call for elections, but the individual could go and elect and re-elect their MLAs anytime they want. That is called a perpetual electoral system. It's one of the questions in our calendar, and I wonder what you think about it.
Well, I think it's an interesting idea. I think that there's lots we can do to enhance democracy. I have some concerns about it. Politics in North America and in democratic countries, whether it be South America, North America, Europe, is very expensive. And the challenge of electoral politics is, and you see it in the United States, where, by the way, they have more elections, they have more referenda, they have more recall, they have more measures that you would think would increase citizen control over government. And we know that's not the case. In fact, they re-elect their House of Representatives every 2 years. And what the effect of that has been to give those with resources hugely more power, because they are in a position every day with money to mobilize people. And the rest of us, people are working longer and longer these days. So I'm not sure. I believe that ideas such as this, that enhance local democracy and enhance individual power, are good ideas. But I think we have to seriously discuss them, and not just. And I think in a general sense that the system we have now, with enhanced citizen power, is probably the best system.
Yeah, you're referring to the amount of money that politicians need in the States to become electable.
And that's it's partly because they have a perpetual election campaign in the United States. It's partly because of that. And that perpetual...
How is that they have perpetual elections in the States?
Well, first of all, they have perpetual elections in the States because, at least in the House of Representatives, they have much more frequent elections than we have in Canada. They have
more frequent, but not perpetual.
And therefore, they're constantly in campaigns. In addition to those elections, they have primary elections to name candidates. They have a very expensive election process.
Well, we have the same thing with parties here.
What we have to do, I think, in Canada, is to take measures to give citizens more control over their lives.
How about control of my vote? If I could recall my vote, wouldn't that give me more?
We have some of those provisions today, and I think, but we have recall and referenda law today that are not widely used.
Because it's impossible to use.
Well, but I think that we have to be careful to not give an electoral advantage to those with the most resources and the most power.
How about to the voter? I am the voter, and I want to have the control of my own vote.
And that I think is a reasonable thing to ask. And that's why though voters have to be given, I think, real choices and real options, and they need to put pressure on the political system to provide those. So I don't think there's one answer to that. I think it's an interesting idea. I don't reject it out of hand. I'm just raising some issues that I think the more elections you have, the more voting opportunities you have. Sometimes you normally think, well, that will increase democratic accountability and democratic power.
And it doesn't?
But if you have significantly more resources to invest in that, then that may give an advantage not to those who right now are under the present system lacking power. It may even enhance the power of others. So I think that's part of the discussion that we have to have. And I have an open mind about it. I'm prepared to talk to you about it. But those are some of my warnings about what you're suggesting.
Would you be prepared to consider that during elections, those people with more resources do have the advantage of more advertising?
Yes.
So that is a problem that already exists. It's not something that would be created if we had perpetual elections. It's the baggage that would come with the system of electing.
I think, though, that if you increase the overall amount spent on politics and the overall power of money in politics, and look, if you had an election every year, if I was reelected every year and went to office.
How about every day?
Well, every day, but let's say every year, because that's more accountability than now, right? Under your sort of thing. If I was reelected every year, first of all, I've spent a lot of time campaigning, which is a good thing, and I do that. I meet with my community and my residents in my community every day. But a yearly election would, I think, give advantage not to progressive politics, but to those who have more resources.
So you're saying more elections means less democracy?
I'm just saying it doesn't necessarily mean it. And so we have to look at measures to enhance our democracy that truly change and give opportunity and more power to individual citizens. I'm saying it doesn't immediately flow. Doesn't immediately flow that having daily elections, weekly elections, monthly elections, or yearly elections gives more power to people if they don't have the means to participate fully in the process. And for me, anyway, the most important political reform issues, and I told you this before, are ensuring that people have equal means. So I believe, that's why I believe that there should be equal spending. If you want to run against me in the next election, no matter what circumstance, I shouldn't have 10 times the means that you do to run and to communicate my message. I think in a democracy that those issues of means are important, and those are important power issues too. And when we discussed this the last time, that's what I said to you. I said that I thought those issues of financing of politics were some of the most important issues in terms of enhancing democracy.
I agree with you 100%. That is an important issue. Yeah. But the term of office is another very important issue as well.
And I'm delighted to talk about it, and I'm interested in it. But I'm just not accepting it out of hand. That's all, Pedro.
Yeah. Would you recommend this calendar here? This calendar that
I think that everybody watching us today should go to nowpolling.ca, where they'll be able to find information about the 2007 calendar from in support of Vancouver Community Television. They'll get information about the 2007 calendar. It's a fantastic calendar with lots of interesting ideas. It will be every month that you read this calendar. You'll see thought-provoking surveys and other ideas, and I recommend to everybody that they buy or send a donation and pick up one of these calendars.
And you're going to send a donation because you have our address there in the back.
Absolutely. I'm looking forward to that. And the address, can I read the address?
Sure.
Is that okay?
Yes.
It's Vancouver, VCTA, at 2088 Pandora Street, Vancouver, British Columbia, V5L1N2. And the telephone number is 604. You don't want the telephone number? You don't want people calling you, Pedro. That's direct democracy. But I won't bother you about that further. I just note that Pandora Street, not in my constituency. You've got to move to my constituency, Pedro.
Well, we are all constituents of Vancouver. I thank you very much for your time.
Hey, anytime. And I think these ideas of I think we should be debating much more often ideas of what democracy means for us every day in our society.